record mode right now. I will be bringing up the presentation. Bear with me one moment. There we go. Okay. All right. And thank you to everyone who is joining us for today's presentation about Pennie. Pennie is a new agency here in the Commonwealth of Pennsylvania. Pennie is partnering with Mayor Matt Pacifico in Altoona to help spread the word about Pennsylvania's new health insurance exchange. And with that, I'd like to turn it over to Mayor Pacifico as he has a few words for us today.
Thank you, Scott. Well, good afternoon, everybody. My name is Matt Pacifico, Mayor of the City of Altoona, and welcome to this education session on Pennie. Pennie was created and passed by the Pennsylvania legislature and signed into law by Governor Wolf in 2019 with a mission to provide Pennsylvanians with access to high quality, affordable health insurance. Pennie replaces healthcare.gov as Pennsylvania's marketplace for individuals and families without an employer-sponsored insurance plan, anyone uninsured, or those who are eligible for Medicaid or CHIP to get the coverage they need and access to financial assistance to make that coverage affordable. Pennie is a continuing force in Pennsylvania's dedication to identifying and implementing initiatives that drive down healthcare costs without compromising access or quality of care. As a state-based marketplace, Pennie has the tools to increase affordability by measurably lowering health insurance premiums for the hundreds of thousands of Pennsylvanians who count on Pennie for coverage. Joining us today to speak more about the benefits of Pennie are Scott Yeager and Juan Valencia. Thank you both for being here.
All right, and thank you so much, Mayor Pacifico, for hosting us. As was mentioned, Pennie was created as an alternative, Pennsylvania's alternative to healthcare.gov. It's a customized health insurance marketplace for those who are seeking better health insurance options. We were quite literally born out of a unanimous bipartisan effort in passing both chambers of the Pennsylvania General Assembly. Basically, people came together under the idea that not only could we provide access and better affordability in terms of health insurance here in Pennsylvania, but we could also stimulate competition in the market. We could also set aside a reinsurance program that could help everyone in the insurance community weather uncertain times and catastrophic losses, much like the pandemic that we all live under right now. But with that being said, our origins started through everyone in Pennsylvania, legislators, policymakers coming together and saying, this makes sense for Pennsylvania. And in doing so, we have, as of November 1st, 2020, Pennie literally stood up. It's the Commonwealth of Pennsylvania's health insurance exchange, and did so in such a way that we did not increase taxpayer money. We did not, we delivered on our promises in terms of insurance rates being lowered by about 4% in the individual health insurance market. In addition to that, we did our very best to migrate about 290,000 current customers that were on healthcare.gov over to pennie.com. The exciting news about that is that our retention rate was 97%. We'll talk a little bit more about the uninsured in Pennsylvania in a moment, but please keep in mind that during our inaugural open enrollment, Pennie increased our new enrollments by about 75,000. So we're here to help, and we are here to help protect the quality of life of everyone here in the Commonwealth of Pennsylvania. Ultimately, our goal is to be the home for high quality and affordable health insurance plans. And here's the important thing. The only, we are the only source for financial assistance in the individual health insurance market here in Pennsylvania. Um, who are we here to help? We are here to help individuals and families who are without employer sponsored health insurance. We're here to help individuals who may not have access to employer sponsored care or to Medicaid or to Medicare. We are here to work with workers in transition. We're here to work with individuals who have just gained lawfully present status in the United States. We're here to serve families and individuals who may be between jobs or who may have had a small business that, like so many we know of in central Pennsylvania, so many small businesses have been impacted recently. And you may be a sole proprietor, you may be an individual who's in workforce transition, and you decide, I'm going to hang my own shingle and I'm going to start a business myself. With that being said, it's good to know that you have options now. Pennie is here to help. Um, the uninsured in the Commonwealth of Pennsylvania rest at about 607,000. And we'll get into that in a moment. But an important thing to keep in mind is that across the Commonwealth every day, people wake up about 1 in 20. About 1 in 20 wake up every day and make the conscious decision to step out into the world without any type of health insurance. Um, that's a significant issue, and that's why Pennie is here to help. We have a no wrong door policy here at Pennie, and we know that health insurance, no one is born with an inherent knowledge of health insurance. In fact, it scares people. It scares people. People often, if you mention health insurance, you know, uh, they have this preconception that, well, it's something that's very, very expensive, and even if I can't afford it, I can't afford to use it. That's where Pennie's here to help. We are the only source for financial aid. About 9 out of 10 of our customers qualify for some form of financial assistance. But we also operate that no wrong door policy. And that no wrong door policy means that if an individual comes to Pennie and they are deemed eligible for Medicaid, we actually person to person warm transfer that individual to the Department of Human Services so that they can receive the help that they need. That's important because that's what Pennie, at our advent, that is what we are trying to address. We're trying to move the focus of health insurance, of the protection that it affords, back to the person. You don't necessarily get that when you're, 1 out of 50 states through healthcare.gov. Part of the benefit of bringing the health insurance exchange home to Pennsylvania was that we could customize it for Pennsylvanians. And we're here to help. Pennie has a customer service team, and I need to stress this. Our customer service team, they are incredibly well-trained professionals who are unbiased. They don't work for an insurance company. And they are there to provide no pressure, no hassle service to our customers who, quite honestly, need legitimate questions answered. And they're there to help from the initial moment of, well, I'm thinking about applying for insurance and I need to compare plans, all the way through to, I wonder if I qualify for financial assistance, to, hey, I've got health insurance for myself, for my family, for my partner and I. That's what we're here for. Now, we also realize that there are a lot of people who would prefer to self-service, and Pennie.com is our website. Pennie.com is something that we take a lot of pride in. It's not pennie.gov. It's not pennie.pa.gov. Our research indicated ahead of time that we needed to create an atmosphere that was open. We needed to create an atmosphere that was welcoming, and one where people could come anonymously and shop for health insurance on their own terms. That's pennie.com. Throughout the Commonwealth of Pennsylvania, my partner Juan and I, we do, do our very best to educate um, the public. But again, our agency is only 4 months old. So from that perspective, we've got a lot of work ahead of us. With regard to in-person and virtual services that are in local communities, there are Pennie certified assisters and brokers throughout the Commonwealth who can work with customers in person and virtually to help them with their insurance. And ultimately, one of the things that we're here to talk about today is when people can get insured. Generally speaking, there's an open enrollment period. If you were on healthcare.gov this past November 1st, you would have had from November 1st until December 15th to acquire your health insurance for January 1 of 2021. Here in the Commonwealth of Pennsylvania, again, because of that local control that we have, we actually extended our open enrollment from November 1st to January 15th and provided individuals with that extra time to get through the hustle and bustle of the holidays and turn their focus again on acquiring insurance and protection for their quality of life. During the course of the year, and see, that's the thing, a lot of people don't realize that they can purchase insurance throughout the course of the year because of qualifying life events that we'll go over here in a moment. But those qualifying life events can trigger a special enrollment period for that individual or for that family when the situation arises. Imminently, and in step with the Biden administration and their federal enrollment period on healthcare.gov, Pennsylvania convened Pennie's board of directors and determined, yes, indeed, Pennie will also have a COVID-19 enrollment period for 2021. This COVID-19 enrollment period goes from February 15th to May 15th, and eligible PA residents can apply and enroll in coverage. Basically, under the COVID-19 enrollment period, as you'll see on the right-hand side here, you will see that all Pennsylvanians have been impacted by COVID-19. This allows the uninsured, which we're about to talk about that here in a minute, that allows the uninsured in the Commonwealth of Pennsylvania to not only shop for their options, but also gain the coverage that they need to protect themselves and their quality of life. Also, current enrollees here at Pennie, they are also able to change their plan if they believe that they may need a better option heading into 2021. Under the COVID-19 enrollment period, they can change their plan. It also allows a current enrollee to add an eligible family member. And the steps for creating or executing on the COVID-19 enrollment period are pretty straightforward. Off to the left-hand side here, you will note that there are other special enrollment period triggers that we have here at Pennie that are based on qualifying life events. It could be taking a partner, getting married. It could be, the birth of a child, adoption, fostering a child. It could be gaining lawfully present status in the United States. It could also be marriage, divorce. There are a whole host of things that may create and trigger a special enrollment period. Some of the most frequent that Juan and I encounter in our work throughout the Commonwealth of Pennsylvania have been workers in transition. I'll be quite honest with you. There's nothing in this world that is more sobering for a worker in transition than receiving a COBRA letter in the mail from their employer. And again, it's a great option to know that you can continue your employer-sponsored coverage under COBRA. But all too often, people look at those COBRA letters and say, my goodness, that's expensive. Well, here's the good news. The good news is that Pennie's here. Pennie has financial assistance. Pennie's here to help. In many cases, we can provide as good or better options for individuals who are in that workforce transition. So again, our goal is to work with the uninsured here in the Commonwealth of Pennsylvania. This particular heat map is one that every time I look at it, it prioritizes the outreach efforts that we have here at Pennie. The darker the green indicates the more significant the uninsured population. Of course, you look at southeastern Pennsylvania, places like Philadelphia, Lancaster, but Blair County, and to be quite honest with you, Cambria County, nearly 5,000 people in Cambria County, 5,300 uninsured in Blair County. Center County, 6,700 uninsured. We look at these uninsured numbers and realize our work is cut out for us. Again, there's a lot of fear. There's a lot of apprehension. There's a lot of misunderstanding about the value of health insurance. And to be quite honest about what Pennie has done in bringing the Affordable Care Act home to Pennsylvania and putting in place insurance options and strategies for the Commonwealth that are really tailoring it to the unique needs of each of the counties you see here. Our goal is to see those uninsured numbers diminish as much as possible throughout the COVID-19 enrollment period and through 2021. What I'd like to do now is I would like to turn things over to my partner, Juan Valencia. Juan's going to talk briefly about the Pennie customer experience. He's also going to, again, revisit some of the information in greater detail about the resources that we have here at Pennie to help people, because as I mentioned before, you can have the best insurance plans and products on the market, but if people cannot gain access and understanding of them, and if people cannot afford them, you basically have a boat on dry land. And Pennie's here to help with that. So Juan, if you would, please take it away.
Sure, thank you. And I do want to thank you, Mayor Pacifico, for his leadership to bring those resources of Pennie to his community. And I think that is something that we admire, and that's why we are here to do this presentation, to make sure all the residents are connected and learn about Pennie. That experience, customer experience, is very tied to the possibilities of receiving financial assistance. I think that's a very good point of Pennie. And who is eligible to receive that financial assistance? So it's anyone that is a citizen or a resident, anyone that is lawfully present in the United States, that have a green card, that have a permit, a work permit to be in the United States. That's important. And it's important to note that Pennie is the only financial assistance is the only source of financial assistance to help to lower those costs of monthly payments and the cost sharing cost as well, like deductibles or those co-pays expenses. Nearly 9 out of 10 customers qualify for financial assistance. And that qualification is based on income and family composition. And it's interesting to know, okay, what group would benefit more of the help of Pennie? Those individuals that are making between $10,800 and around $51,000, if it's just one person. If it's a family of 4, if it's less than $106,000, will be most likely to receive a lot of benefits, financial benefits with us. In average, we already started in November 1st, as Scott was mentioning. We are very new, but we already have some numbers that in average, we are saving $515 a month to the individuals. So that's a pretty significant amount that goes towards being able to afford healthcare and the good quality of that healthcare. In addition, if you do not receive that financial assistance, something important to know is that that reinsurance program that this piece of legislation create allows the market to be a healthy competition for the insurance companies that work with us. And that has reduced 4% all the individual rates for health insurance in Pennsylvania. So we're already moving towards a more affordable healthcare in our state. It's important to know that Pennie offers health and dental plans, and we literally get the good quality health plans, and they are based on the ACA, the Affordable Care Act, 10 essential health benefits. So we offer emergency services, prescription drugs, maternity and newborn care, lab services, rehab services. So all these important elements of healthcare plan. So we do not offer junk health plans. Actually, the plans that we offer through Pennie are really good. You cannot be denied due a pre-existing condition, and the individuals under 26 can remain on their parents' coverage. There are big companies that are working with us in Pennsylvania, in health, in the medical aspect. You may recognize some of them: Capital Blue Cross, Geisinger, Highmark, Independence Blue Cross, UPMC. And in dental, we work with also leaders in the market like Delta Dental, Dental Quest, Dominion National, all these companies. So Pennie is not the insurance company. Pennie is the exchange that brings those private companies, create a more affordable rates, but also offers the financial assistance to the community. So if we go to the next one, next slide. So the way that we help our customers. So we offer, let me introduce our website. As Scott has mentioned before, is pennie.com, not pennie.gov. We make it more friendly. This is full of resources for individuals that wants to learn what a healthcare plan is, everything about financial assistance, for organizations and community partners that are out there that want to help the community. We have toolkits, marketing toolkits with Spanish videos, English videos about all the topics to help people to understand better and make more easy to navigate the insurance industry, the health insurance industry. We do have a 1-800 number that is important and connected always to the website, and also help through the assisters and other networks like brokers. Individuals can come really easy to, I'm sorry, Scott, if you go back for a second, thank you so much. If we are inviting everyone to come to our webpage, pennie.com, with 3 very easy pieces of information: your estimated income, your age, and your zip code. You can look at the plans without putting any other information, and you can see if you qualify or not to financial assistance. So we always invite you to come visit us in pennie.com. Go to that yellow button that you will see there, Get Covered, and see for yourself if you qualify for financial assistance. You are not required to add any other personal information, your name, your phone number, your email, nothing. It allows you, the website allows you just to see if you qualify for financial assistance and how much has that. And if you decided to apply and join Pennie, you can easily complete the application through our website. In case that you need help, and now we go to the other slides. In case that you need help, we do have 1-800 number. It's 1-844-844-8040. I repeat, is 1-844-844-8040. That number will be there in the next slides as well. We do have plenty customer service representatives. They're bilingual as well. We receive about 200 calls every day in Spanish for people that wants to learn more information and receive more information in Spanish. We have English, and we have also a language direct access line for anyone else, Vietnamese, Russian, Chinese, any other language. You can have literally that 3 points of conversation with someone at Pennie and in your own language as well. So we want to make sure that everyone is included. We have a very large community of refugees and immigrants in our communities. We want to make sure that everyone is welcome and can understand what are the options. We do have also, if you are, some people prefer to have these conversations virtually or on the phone. But if you want to meet someone as well, we have a network of brokers. There are professionals, registered and licensed brokers in Pennsylvania. In our website, you can literally select by the zip code what broker agents are working with Pennie. So they are the ones that also can answer very specific individual questions about healthcare difficulties that you may have. We do have a network of assisters around Pennsylvania. Those assisters are also called navigators. Most of them work with health centers in our communities, community organizations. Many of them are social workers. And Scott just mentioned, I mean, we are a new agency. We started in November 1st. So we are building up these networks. And that's why it's so important for us to come to these presentations. As if anyone, any organization is interested in joining Pennie and becoming an assister, we do have offer all the information on how to become an assister, and the training. We provide also training. So as we continue growing at Pennie, there are many opportunities for the community that we want to announce. There are jobs that are available at Pennie because we are growing, and there are opportunities to become assisters. There are opportunities to join as well as brokers. If you go to the next slide, Scott, thank you. I want to emphasize that our call center, it's open from 8 to 6 p.m. And again, everyone is ready to help, to navigate, to guide you in any of the questions that you may have. If you go to the next slides. So there are different ways to help Pennie. One of them, which is important, is to recommend pennie.com. Still, a lot of people don't know about Pennie, even though we have spent already a very robust marketing campaign. in ads and Facebook. Guess what? Not everybody watches Facebook or Google or watch certain type of TV. So all these outreach campaigns that we are literally doing every day are extremely important. And they are extremely important. That's why we really appreciate the leadership of municipal leaders that are inviting us to get connected with those communities, because we want to spread the word. We have a Facebook account, we have a Twitter account. You are welcome to connect and stay informed. And we also have an outreach and education work group that meets every Wednesday, first Wednesday of the month, where we invite anyone. We welcome suggestions, feedback, thoughts, ideas, and we are growing. So Pennie is here to serve. We are here literally to serve the community, to connect with the community. We are extremely accessible. If you want us to duplicate this type of presentations in English or in Spanish to your community, please access to us. Anyone that you think may benefit for learning about what Pennie is doing, please refer to us. I just want to point that when we receive Pennie, when we receive the customers from healthcare.gov, there were 270,000 Pennsylvanians that we received in November 1st. We already increased that number in 75,000 new customers. So we are doing a tremendous job in offering financial assistance and connecting people to healthcare insurance. But we still have a lot of way to go. And those are the challenges that Scott was mentioning when he was pointing the map of the uninsured population in Pennsylvania. So there are other areas that definitely we need to go there. And with your help, we can do that. So we thank you again for your attention, and we welcome any questions that you may have. I'm gonna take a look at the chat if we have any questions or comments or suggestions. Our contact information is on the chat as well. Mm-hmm. Scott, I believe you left, yes, you left your email and your phone number.
Correct. In the chat, we have a few interesting links for folks, and again, you're more than welcome to reach out to myself or to Juan if you have questions after. Also, an important thing to note is that we have resources that are available in the chat. You'll see a link, of course, for pennie.com, but you'll also see a link to our inaugural annual report, our first annual report. And in addition to that, we have a toolkit that can help if you want to share information by way of social media. But if you have questions for us about Pennie, please feel free to unmute yourself. You're more than welcome to ask questions. And that's what we're here for.
Well, Scott and Juan, I just want to say thank you both for taking the time to do the presentation today. That was really informative. I have kind of following up on something that you mentioned, Scott. I think you said about, you guys are trying to connect with folks who might be transitioning in the workforce. So has there been any discussions between yourselves and in CareerLink on how you two could, kind of partner together to match those folks up?
Mayor Pacifico, on a couple levels, and thank you for asking that question, because Pennsylvania Career Links are absolutely vital to not only connecting with workers in transition, but also connecting with businesses that are in transition right now. We have, as recent as yesterday, we have met with Pennsylvania career links throughout Pennsylvania. What I can say is that we have yet to connect with the Pennsylvania career links in Blair County, Center County, Cambria County, Clearfield County, Jefferson, Elk. We would more than welcome the opportunity to connect with the career links in your area, and not only provide education for their staff, but if they have a group of individuals that are in transition that they would like either one or myself or both of us to share information with about Pennie and the alternatives that Pennie has for individuals who are in transition, we'd be more than happy to do that. It's a big concern, and not only being, how can I say this, being uninsured is frightening enough today, but being uninsured and also in between jobs or transitioning into a new business or from a business back into the workforce, that's a whole lot of stress and
Yeah.
a whole lot. Yeah.
Mayor Pacifico, I also want to add as well that the Department of Labor and Industry of Pennsylvania has invited us with the Career Link as well to participate in different presentations like these ones to certain companies that are reducing and they're literally laying off hundreds of people. So Scott and I have been meeting with them, making this presentation and presenting them an alternative, an option. Many people, I mean, this is happening with the pandemic. It's affecting effectively a lot of the companies around the Commonwealth. So at least we have the opportunity to present an offer, an option to them with Pennie. But it definitely is in our radar, and we're more than willing to work with them. Absolutely.
I would be happy to connect you with the folks from the Blair County Career Link.
Mhm. Excellent.
Yeah,
Well,
thank you very
yeah.
much, Mayor Pacifico. And just one more thing, if there is an opportunity, we want to thank you your leadership. It's for real that is so refreshing to have in the Commonwealth of Pennsylvania a mayor that is inviting us. And if we can somehow invite other mayors, I think that would be amazing. So if there is any suggestions that you may have, how can we motivate? I don't know if we're doing like a challenge type of activity with other mayors, but it would be absolutely important for us to be able to cover many municipalities all over Pennsylvania.
Well, I'm also involved in the Pennsylvania Municipal League, so I would be more than happy to kind of send your information off to the executive director there to kind of connect you with some of the other mayors in other cities across the Commonwealth.
That would be
No,
phenomenal. That would be,
absolutely.
thank you so much, Mayor Pacifico. And as we mentioned before, this session is being recorded. We will be here after to answer any questions that you may have. Juan and I are both very accessible. If you have questions, you can either reach out directly to pennie.com at 844-844-8040. You can also visit pennie.com. That's one of the best ways to get your questions answered. But ultimately, this presentation is going to be recorded. We also have a presentation tomorrow evening that will also be sponsored by Mayor Pacifico's office. And again, we can't thank you enough for providing us with the opportunity to address Altoona. And with that, I will end the presentation if there are no more questions.
Nice.
Do you have a question? Okay. All right. Well, as I mentioned, the presentation is recorded, and we will have that out very soon. if, there we go. There we go. I am going to stop recording at this moment.